The Biggs rule is a high-yield diagnostic principle in electrocardiography used to unmask atrial flutter or atrial tachycardia with 2:1 AV block. It is named after Dr. Harold Biggs, a Viennese cardiologist who noted this specific pattern of hidden arrhythmias. If you encounter a narrow complex supraventricular tachycardia where a visible P wave or flutter wave is situated exactly midway between two QRS complexes, there is a high probability that a second hidden P wave is lurking within the QRS complex ST segment or T wave. In typical atrial flutter, the atrial rate is approximately 300 beats per minute. The AV node typically cannot conduct at this rapid rate, resulting in a physiological 2:1 block. Some call it 2:1 conduction. One atrial depolarization conducts through the AV node, resulting in the visible P or flutter wave and the subsequent QRS complex. The next atrial depolarization hits the AV node during its absolute refractory period. Because it occurs exactly halfway through the cardiac cycle, this non-conducted wave falls simultaneously with the QRS complex, or sometimes the T wave, generated by the previous beat, hiding it from plain sight. This leaves a ventricular rate of roughly 150 beats per minute with only one visible atrial wave between the QRS complexes, mimicking other rhythms. The Biggs rule is a critical red flag to prevent misdiagnosis when faced with an SVT at a rate of approximately 100 beats per minute. Suspect flutter. Always assume atrial flutter with 2:1 block until proven otherwise. Scrutinize the QRS. Look for subtle notching, slurring on the upstroke or downstroke of the QRS, or a distorted T wave that might betray the hidden flutter wave. Vagal maneuvers or adenosine. If the diagnosis is unclear, transiently slowing AV nodal conduction with vagal maneuvers or adenosine will often unmask the classical sawtooth flutter waves. Recognizing this prevents the erroneous diagnosis of sinus tachycardia, where the PR interval would not be prolonged usually, or AVNRT, fundamentally altering the clinical management and anticoagulation strategy.